Weather is a recurrent phenomenon that comes with seasons. Here in Borno, there is usually a drastic downtick in atmospheric temperature in between the months of December and January, resulting to harsh cold weather. This cold weather triggers a lot of health challenges in humans. With me is a medical expert with the State Specialist Hospital, Maiduguri, Dr. Muhammad Nur Abubakar Mustafa, who would tell us the implication of this harsh weather.
Thank you, Pauline. The air that we inhale in affects virtually the respiratory aspect of the humans. However, this harshness will lead to some disease condition and aggravate some already existing ones. The cold, on the other hand, also affects and aggravates some other conditions like asthma, bronchitis, chronic obstructive pulmonary diseases. The cold will now constrict the blood vessel, which will now reduce the blood flow, which in turn will lead to some bronchospasms, which will now cause disease conditions. And as a result of the cold, people will now tend to come together, stay in one room, and then be crowded. People that cough do now change normal flora that they do have in their body, which will subsequently cause disease to the other person.
What are the remedies to these cold weather challenges?
By virtue of just putting nose masks, you are preventing yourself from bacteria, you are preventing yourself from cold and dryness. Taking plenty of water. If you know you have health challenges, take your medications regularly and visit the hospital for a regular checkup. This will now help and then reduce the burden of the weather on people that are having some background disorders. Using of garments in form of sweaters. Don't go outside or outdoors, especially during the morning hours. That will now reduce the exposure of anyone that is having those kind of diseases.
With this analytical advice from the medical experts, the way out now is adherence to the remedies. It's back to you in the studios.